Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. Today, we will have a very special live session where we dwell into the complex relationship between HIV and cancer. I am guess it's a very thrilling topic to go ahead. And today, I am thrilled to know about this topic, double trouble complex combination of from our distinguished expert, Mr. Dr. Krishnamani, in the field of oncology. Dr. Krishnamani is joining us today to share his knowledge, experience, and insights on double trouble, the trouble between the, or you can say the relationship between a HIV and a cancer. It is a pleasure to be here and to discuss on this topic. And especially the connection between the HIV and cancer is like multifaceted and have profound implication from patient care. Without any further delay, I will just welcome Dr. Krishnamani and I will request Dr. Krishnamani to add some opening insights to this session, Double Trouble on HIV and Cancer. Doctor, please.
Hello everyone, welcome to Cancer Reach. As you all know, Cancer Reach is an initiative to spread awareness about cancer. Apologies for the delay today. And today's topic is on HIV and cancer. December 1st is World HIV Day. And we take this opportunity to learn a bit more on the complex relationship, as you already discussed, between HIV and cancer.
Thank you, doctor. Thank you for this insight. So let us, without any further delay, let us start this exciting session on the double trouble, which is HIV and cancer combination. So doctor, can you give us a brief on HIV?
See, HIV is known as what is HIV? Human immunodeficiency virus. So it's a virus. It causes deficiency of your immune system, immune deficiency in humans. So I think the first few cases were discovered way back in the 80s, 85, 86. And then it became an epidemic. A time came when we were kids in the early 90s, when there was a lot of awareness on TV. There was no social media at that point in time. A lot of ads that regarding the taboos associated with HIV. So HIV it became a new subject altogether in medicine. It was like tuberculosis in the 30s. Okay, yes. So here was a new disease which was not there before the 80s. People didn't know what it was all about. There were lots of myths about it, that it would spread by touch. It would spread if somebody kisses someone on the cheek, and so on and so forth. So more than the information, the misinformation on HIV was more. And as I already told you, HIV is a human immunodeficiency virus caused by a virus HIV-1 and HIV-2. So what it basically does is you contact the virus, and when one contacts the virus, his or her immunity goes down, and they are susceptible to a number of infections. We have realized over the period of time, now in the last 40 years, HIV has become a chronic disease. I would not say but mostly like diabetes or hypertension, where many patients are surviving for a very, very long period of time. In the early days, people used to die in 6 months, 1 year, or very early with all kinds of opportunistic infections. By opportunistic infections, you mean infections which are not commonly seen in healthy people. The infections become opportunistic, they come into you and they kill you. Same way, these people were also prone for a variety of cancers, which were not that commonly seen in the general population. For example, a Kaposi sarcoma. For example, a primary effusion lymphoma. You would not see these cancers so commonly in HIV negative people like in HIV positive people. But what has happened over the years is research has gone in, science has developed. We have a lot of new medicines called highly active antiretroviral therapy, HAART. So because of these medicines, antiretroviral, those medicines are stopping the HIV from spreading or replicating or dividing in your body. So the virus is dying, viral load is coming down, your immunity is going up, because of which the patient is able to fight. His immunity gets better, he's able to fight infection and also able to fight cancer. So this is in a way a brief introduction of what has happened over the last so many decades.
Doctor, I completely agree with the point. Even when I was kid or in my college days, to share a towel, we were worried that whether the AIDS can be the reason which can be spread by sharing a towel and many etc. things like in hostels when I used to live. But it's a very informative, doctor. You have rightly addressed it. Doctor, why HIV people are like at high risk for cancer?
So what we must understand is when we have HIV, our immunity goes down. When your immunity goes down, your lymphocytes go down. You don't have an ability to fight any infection or any foreign thing. So these people have a high risk for getting anything in the form of be it infections or be it cancers. Second, HIV itself has an oncogenic property or a cancer causing property, the researchers say. Third, the root of HIV is usually in high risk people, like people who are drug abusers, people who have follow unsafe sexual practices. These kind of people also get other viruses like hepatitis B, hepatitis C, which can cause liver cancer, or HPV, human papilloma, which can cause cervical cancer. That is why these cancers are more common in HIV patients. So one is the virus itself. Two is the immunity, which is lowered, and that is making you susceptible to infection and cancer. Three, along with HIV, you get other cancer viruses also, which can lead to hepatitis B, C, or HPV, which can lead to other cancers. Four, again, as we discussed, because of the habits, they are high risk people. High risk means they have high risk behavior. They may be smokers, they may be drug addicts. So the incidence of lung cancer increases because they are heavy tobacco smokers or heavy zarda chewer. So that's an environmental factor. So all these factors put together lead to a scenario where HIV patients have an extremely high risk of getting cancer.
Thank Doctor. Before we move on, there is a query from the audience from Manju asking, are HIV and AIDS the same thing?
So AIDS is the syndrome or a constellation of symptoms. HIV is you getting infection. So somebody can get HIV but not have full-blown AIDS. AIDS means you have all the symptoms of advanced disease. So that is, they are not the same, but obviously HIV leads to the development of the symptoms.
Sir, doctor, there is one more query from Firoz asking that HIV will cause cancer.
Yes, that is the whole reason we are discussing today.
Yes. Yeah.
And that is why we call it double trouble. Cancer itself is one headache, one trouble, and then you have HIV over that. That's why we call it double trouble.
Double trouble. Doctor, moving on, what are the common cancers in HIV patients and what are AIDS-defined malignancies?
Yeah, so this is an important thing. So HIV patients can get cancer like any normal individual. What are your common cancers? Head and neck cancer, breast cancer, lung cancer, colorectal cancer, etc. So just because other people in the general population can get some cancers, this person is also susceptible to get. But because of HIV, there are a few cancers which are more commonly seen, like which is called AIDS-defined malignancies. So, what is the definition of AIDS-defined malignancies? So, in the earlier days, there were few cancers which are very commonly seen in HIV patients, like Kaposi sarcoma, like invasive cervical cancer, like non-Hodgkin's lymphoma. So, medical bodies have placed that if these patients have these cancers, they are called AIDS defining illness. So, or AIDS defining cancers. So, they are susceptible to all cancers. They can get all cancers which people can get in the general population, but certain specific cancers which are more common in HIV patients are Kaposi sarcoma, which is a skin cancer. It's a vascular problem. It spreads sometimes to the oral cavity, to the lungs, etc. These people can get cervical cancer, which can be really deadly in the women. They can get all kinds of lymphomas, which are extremely aggressive, even in the young people. Rarely they can get different types of lymphoma called lymphoma in the brain, which is called primary CNS lymphoma, or a primary effusion lymphoma. That is, it's a lymphoma, but there will be no lymph nodes. The patient will present with water around the lungs. That is called primary effusion lymphoma. Primary means it starts in the lung. Effusion means water around the lung, and there is no lymph node anywhere else. So these are all rare. You don't see it in very fit people or immunocompetent people. Immunocompetent means somebody like you and me who have very good immunity. So these lymphomas and all, you will not commonly see in immunocompetent. So the minute you see a Kaposi sarcoma or the minute you see a primary effusion lymphoma, it should ring a bell in your brain that test this patient for HIV. He can be HIV negative. I'm not saying HIV negative will not get this disease, but these are age defining malignancies. So get a HIV test done.
So, doctor, is it like all the HIV patient will end up in the with cancer? Is that rule something?
So what used to happen earlier is, understand, in the early days when there was HIV, to understand that there is some problem called HIV, it took us many years. It took us a lot more time to find that it is because of a virus. And once they found it out, they had to find the right treatment. So in that time period, what happened is people used to get HIV, they used to transmit to other people, die. And they had all kinds of things which were seen in them. So you are basically not treating this guy, and this guy is going to go through all the unfortunate incidents. Then, once treatment has started, the treatment, what it does is, it immediately helps in improving your WBC count or your CD4 count, or it improves your immunity rather. Okay, that's a better way. That's called immunological recovery. And it also leads to virological decrease. That is, the virus also goes down or gets killed. So one side virus gets killed, another side immunity goes up. So because of which what happens is you are becoming immunocompetent. Your immunity is getting better. When your immunity is getting better, you will not get all these bad infections or bad cancers. So now you have heart, highly active antiretroviral therapy. In the last 40 years, so much research, HIV patients have become chronic. They are taking tablets and going to work and doing everything. Their lifespan is in many years or decades. So now what has happened, because their immunity is so good, you don't see these age-defining cancers that commonly in patients whose immunity is better. But please understand that when you live longer, you always have a risk of cancer. Okay? So time will tell, and we are also seeing that in longer survivors of HIV, they get different kind of cancers. But when treatment was not available, they used to get different kinds of cancers. So HIV will lead to cancer, but not all HIV patients get cancer. And if you get treated well and on time, your immunity improves, viral count decreases, and that is done to prevent infections and cancer.
Doctor, has art changed this scenario?
Yes, that's what we were discussing now. So, heart, what has it done? It has improved your immunity, reduced your viral loads. It has completely changed the scenario. You look at cervical cancer in HIV patients, some 25 years back, patients used to die within 10 months of diagnosis. So if a HIV patient develops cervical cancer, she will die within 8 to 10 months. This is proven in studies, in literature, in medical literature. Now it is not like that. You will treat that person very similar to an ordinary person who has cervical cancer, who is HIV negative. You will give the same radiation, same chemotherapy, may require the same surgery, and the results are almost the same if they take heart and their viral load is minimal and their CD4 count is more than 250, or their immunity is extremely good, to put it in very, very simple terms. So heart has been a game changer. And many times, if you don't give heart, we measure something called CD4 count. That's your lymphocyte count. The CD4 should be above 200 or 250. That's a very good number. If your CD4 is below 50, you can get all kinds of cancers, all kinds of infections, and all kinds of complications due to your chemotherapy also. So to give certain medicines like rituximab in lymphomas, they say your CD4 should be more than 50. How will your CD4 go up? If you give heart. So heart is necessary for survival, for prolonging survival, for reducing viral load, for improving immunity or immunological recovery, for making that person fit for treatment, and for being eligible for certain treatment.
Oh, doctor, that was quite an informative. This is something which I have came across for the first time, doctor, in my life. Doctor, there is a query from Venkatesh telling that all cancer has equally associated with HIVs.
No. So Kaposi sarcoma has high. So if you look at the standardized rates or something, it is called age standardized rates. Kaposi sarcoma, the risk in HIV people is more than around 4,000. The risk in an average population is maybe around 200 or I think 220 or something. So lymphomas, Kaposi sarcomas, primary CNS lymphoma, primary effusion lymphomas, cervical cancers, these risks are extremely high. Okay, in HIV population, and also in those who are not being treated with antiretroviral therapy. But if you treat them, I will not say your results are equal to the general population, but your results are better.
Doctor, is cancer in HIV patients different from non-HIV patients?
That's a very important question. So, cancer in HIV, take these few thumbnails, presents at a younger age,
Hmm.
presents at a higher grade, is aggressive, that is, spreads quickly, presents at a higher stage. In a non-HIV, maybe stage 2, you somebody with HIV stage 4 or stage 3, advanced stage, less responsive to treatment, and poor prognosis, poor survival. So everything is bad in HIV. They present early, they present bad, they present at last stage or advanced stage, they do poorly with treatment, their prognosis is bad, they survive less. That is why they effort to improve all this with first antiretroviral therapy and then treatment or cancer specific chemotherapy or immunotherapy or whatever you call it.
Yes, doctor, these two when come together is a very deadly combination, I should say.
Definitely, definitely.
Double trouble is little bit a better word to be used, doctor,
So
as
we have
you
been
explained.
very nice to HIV and cancer.
Yes, yes, doctor,
Uh,
obviously. Doctor, there is one more query from World 24. Cancer is the only serious health condition for people with HIV.
HIV itself is enough a serious
Yeah.
condition. So HIV itself can kill someone, and cancer is enough to sit on that and maybe trouble you even more. So that's again the whole point, double trouble. That's the whole point because you're dealing with two terrible things, and you don't know which to deal first. Whether to, uh, they say there's a saying, this sort of fire or the sea or something in English,
Yes,
the
yes.
frying pan or the fire. So it is very similar to that. You don't know uh, where to start off with.
Oh,
That's the whole point.
that can be a very challenging doctor sometimes
Because
for
imagine
you.
if somebody has a very advanced cancer, you need to start treatment as soon as possible, but the CD4 count
Yes.
is 0 or 20. You cannot wait for chemotherapy. You cannot start chemotherapy and wait for immunity also because chemotherapy can kill the patient when the immunity is so low. So what do you do? Cancer is going to kill this guy. HIV is not allowing me to treat him. Where do I go? That's why that's where the whole point. HIV positive patient who is CD4 high 500,000 taking medicines nicely and gets a nice cancer like maybe a stage 1 breast cancer, your treatment is run of the mill, like how you treat an ordinary individual. HIV, CD4 0, not on treatment. Imagine he has hepatitis B, hepatitis C also. On that, you get some Kaposi sarcoma or NHL, for which you cannot give rituximab. He's in an advanced stage. So, one side you cannot treat. If you don't treat, cancer will grow. If you treat, HIV will become worse.
Yes.
And you'll get all kinds of infections. What are the infections? I want to emphasize on that. HIV patients get a lot of fungal infections called candida
Okay.
infections. HIV patients are prone to get a lot of infections called pneumocystis, which can damage the lungs. HIV patients can get a lot of bacterial infections, a lot of viral infections. And again, these are not so common in the general population. So,
Mm.
overall, these people get all sorts of infections also, which are going to trouble you.
So it's not double, doctor. We can claim it as a triple trouble.
Triple, quadruple, keep adding adjectives.
Yes. Doctor, there is one more query from Maheshwari asking HIV and cancer are always fatal.
No doubt about it. But
Is it? Mhm. Mhm.
But we have seen we have so many patients whom we have treated. The silver lining is don't be scared treating HIV, number one, and cancer, and improving the immunological recovery is more important. And once the CD4 goes up, the standard treatment for cancer should follow, and God willing, the patients will do well. So it is not that don't give a death sentence the minute a patient has HIV and cancer. There are multiple factors, and the patients will do well. We hope.
Actually, doctor, cancer itself, when here we get fear. When it comes on HIV, the fear will become double.
True, true, agree.
Doctor, moving ahead. Doctor, can chemo and immunotherapy be used in HIV patients?
So this is a common question people ask. Can we give? Yes, you can give. So cancer in HIV is treated almost similar to non-HIV patients. Chemotherapy can be given, but as I told you, You will wait for the counts to recover or your immunity to slightly get better. Rituximab, preferably we use it if the CD4 is more than 50. And immunotherapy can be given in HIV. That's a very, very well established thing. Immunotherapy doesn't deteriorate your HIV. Immunotherapy doesn't cause more side effects in HIV patients, or immunotherapy doesn't give less benefits. So benefit is equivalent, side effects are not more, and it works in HIV patients. So they have to be given if it is part of standard practice.
Okay. Doctor, could you elaborate on the types of cancer that are most associated with HIV?
So this question is, though it is a form of repetition, it is worth the repetition. Rare tumors which we don't commonly see in the general population, like Kaposi sarcoma, like primary effusion lymphoma, like primary CNS lymphoma, like plasma blastic lymphoma, like plasma cell neoplasms, like invasive cervical cancer are all more common in HIV. Otherwise, your breast, lung, Hodgkin's lymphomas, colorectal cancers, etc., are all anal cancers are all seen in like how you see in the non-HIV population.
Doctor, there is a query from Kriya Designer asking that lifestyle factor or any individual with HIV should consider will be considered their risk of developing cancer.
Yes, so HIV patients have a very generally they have a very high risk behavior, right? Usually we see it in drug addicts, we see it in patients who share needles, we see it in patients who have other habits like smoking, addictions, who have other viruses which transmit by the same route, hepatitis B, C, HPV. So that risk is very, very high. So the whole point is they should try to cut down this risk, modify their behavior. So through Cancer Reach, what we want to tell people also is, see, you have a risk behavior, reduce the risk. Do not smoke, do not drink, treat your hepatitis B, treat hepatitis C, take heart for your HIV. So all this will help you to keep your diseases under control and go that extra mile.
That's actually a good point. Actually, nowadays the era is such a thing that they don't think about the future and the what can condition end up with.
Yeah, so it's all we are in the QR code era where everything
Yes.
is a snap of a button. But what we must also understand is with this high risk behavior, today you are not going to have problem. Problems are going to come after 10 or 20 years, and it is not worth it. It is not worth it. So uh, to re-emphasize, stop smoking, quit oral tobacco, no pan masala zarda, do not take alcohol, take hepatitis B, C vaccination, take cervical cancer vaccine for young boys and girls. If you have hepatitis B and C, get yourself treated. You are HIV, non-HIV, do your pap smears every 3 years after the age of 21, do your mammos every year after your age of 45. Treat your HIV by highly active retroviral therapy. They're very cheap. They're available even in the government hospitals. So, and do your regular screening procedures, do your regular self breast examinations. So these are all extremely, extremely important. Once we follow these, we are more or less okay.
As doctor, you in the starting line, you told no smoking and drinking. They became a fashion icon in nowadays youth. So
Yeah. No,
that's
everybody
the
will
wrong
be very,
definition.
but that's a big no. And with regard to HIV, hepatitis B, C, and HPV, follow safe sexual practices. That is another very important thing. Follow safe sexual practices. So all these kind of unsafe sexual practices, unnatural sexual practices, better avoided. No, not even that's maybe a milder term from my side. Keep a strict no. So that's better for you and for your partner.
Doctor, moving ahead, I know, but it can be a repetition, but doctor, still we will love to hear it. What are the prevention methods of HIV patients with cancer?
So the prevention is what we just spoke about, all your high risk behavior. Apart from that, screening, which we usually discuss on Cancer Reach for the normal population, has to be applied for the HIV patients also. In certain conditions, you will probably start screening much earlier. So HIV positive people, maybe cervical screening, you will do it. So in the ordinary population, you say once in 3 years, but how many women get it done once in 3 years? So at least for the HIV patients, you're going to re-emphasize, get it done once in 3 years, get your HPV testing once in 5 years, get your mammos done once in a year after the age of 45. Okay, so those
Yes.
things are important to be re-emphasized. So screening doesn't take a back seat. Prevention is primary. Risk modifying behavior is primary. Treatment of all your at-risk conditions, hepatitis B, C, HIVs, and HPV infections is paramount. With all this, you're going to cut down the risk of cancer. Despite this, if you still get cancer, you can still get treated and still do well. So that is what we should understand. Not everybody is going to land up with cancer.
Yeah. So, doctor, like you told, screening for cancer, but is there any like screening for HIVs also along with the cancer?
Yeah, the screening for HIV means now imagine you want to go and give blood to your
Huh.
friend who's admitted in a hospital. They're just not going to take your blood, though you're the same group, and give it to her. They will check you if
Oh,
you have hepatitis B, hepatitis C, HIV, and a lot of other viruses. So that itself is a testing and a screening. So
okay.
yeah, so when that's the advantage of today's blood banks or the advance which our country has made, where such simple things are very important. There are some people who have no high risk behavior, but they say maybe 30 years back I had some blood transfusion, I don't know, I got hepatitis B, hepatitis C. Today you don't see those kind of things. It's very, very rarely heard.
Yes, yes.
So that's your way of getting tested. And HIV testing is so easy. You can just walk into the hospital, sign a consent form, and give your blood and get tested for HIV. And that's your right.
Yes, doctor rightly said. Actually, these are some of the basic information. If everybody will come to know, they will be more alert in their coming life.
Yeah, very much agree.
Especially the definition of style telling smoking and drinking will change, especially with this Gen X generation.
Yeah, see, at the end of the day, the only guys who are making money are the cigarette companies.
Yes, even though I guess if I'm not wrong, the prices month on month it is increasing, but the sales are not decreasing.
Yeah, that is because see, the government is trying its own level best to put a very bad photo on the cigarette cover saying that somebody has a bad cancer. Even looking at that, this fellow smokes a lot. Even though the price is jacked up, the cigarette cost is so expensive, still people are ready to
Yes,
spend and smoke. So the
yes,
behavioral change should come from within, that you don't want to smoke, you don't want to drink. Be it men and women both. We see a lot of women smokers now, especially in the urban areas. All young women. So it's not a fad. Let women fight with men on for equality and all that on other fronts. Not that you smoke, so I will also start smoking. You drink, so I will also start drinking. You don't. You're not going to have feminism debates there. So that is important.
exactly. Rightly said, doctor. This kind of argue I have seen many times in my colleagues between.
Yeah. So fight, saying let them fight for a better salary, better job profile, whatever, working hours, working system, whatever. But not that, okay, why if men smoke, why we should not smoke? So give us a special smoking zone for women. Let women also get off day. So that's not required. Let men also not
Yes,
smoke, let women also not smoke. 40% of
yes.
our cancers will come down.
Touch wood, sir. That's a very challenging note, but that if that note is accepted, the India will like improvise. I cannot say how much money will be saved in the family.
That is what we are going to discuss in the next time around, the financial implications of cancer.
Wow,
So
that will
just to
be
put one line to continue that, see, as you said, when one man smoking and getting cancer, the whole family runs behind that fellow.
yes,
His wife leaves the job, or she's a housewife, she has to leave. This bugger doesn't go to work. So all his savings are lost. You spend for extensive treatment. Some friend, some brother-in-law, somebody has to work for him, stay with him in the chemotherapy for 2 days, 3 days. Out of pocket expenditure. So all this we are going to discuss in the, so one habit. See, if you get a cancer for no fault of yours, nobody is going to blame you. It's pure fate, if I can call that. But if you smoke and get lung cancer, eat tobacco and zarda and get tobacco oral cavity cancer, you're all to be blamed. And
yes, agree.
financially, you will go downhill, and your family will come to the streets.
Fully agreed, doctor. Fully agreed. So,
This is what
doctor,
we are going to discuss next time around, cancer and
that
its financial implications.
in fact, doctor, I should say I will be desperately waiting for that next session, which you have right now mentioned it. Because it is more interesting. Obviously, the double trouble is interesting. Continuation is also very interesting. Doctor, here, I know it's a repetition, but it will be helpful for the audience. What screening and prevention measures are essential? Anything specific note you would like to highlight?
All that we discussed, right? All that we discussed right now, and let's understand what is high risk behavior and try to refrain from that.
So, doctor, this was a very interesting session. In fact, a very learning session on a double trouble, especially the deadly combination of HIV and cancer. So, doctor, a big thank you to Dr. Krishnamani for sharing his expertise today, especially on the double trouble. And as we have learned that HIV and cancer can be a very deadly combination. So as doctor has rightly suggested, I hope doctor, everybody will imbibe this information in their blood and they will go ahead. Doctor, before closing the session, I would love to have some closing insights from you, doctor, on this double trouble cancer and HIV combo.
Yeah. So, see, as a clinician, it is very difficult for us to treat patients with HIV and cancer. And as I told you, these patients present young, very aggressive behavior, very advanced stage, and so on and so forth. And treatment becomes very complicated. Cure rates are minimal and all that. So let's put every effort we can not to contact this deadly virus as much as possible. Try to stay safe so that when you're stopping this virus or not getting this virus, you're also protecting yourself from the risk of infections and a wide variety of cancers which you will never see in your lifetime. So that's the whole point.
Thank you, doctor. Thank you for your valuable insights. Thank you once again for your dedication and participation to the audience, and wishing all a good health and strength to the journey. Thank you, everyone.
Thank you so much.
Thank you, doctor.